Dr. Marlon Jackson of Auburn Dental Care, and myself and the staff, we're going to be doing an implant, placing an implant in number 30. For those of you who don't know what an implant is, if you have a tooth removed, you have a space. And usually when you have a space, the only way that you can replace that is with a bridge or a partial. An implant is the best replacement because it only involves the space. With a bridge, you have to prep the adjacent teeth to the space. So today you're going to see us place the implant, and all will be well. Our patient has had their vital signs taken. We're about to give them anesthesia, and we'll be starting in a few minutes. See you then. Water, that's it. Turn this way for me, please, patient. This is the space. There was a tooth in there. It was root canal treated. The tooth decayed. So now we had to extract it, but this is what we're going to replace it with. Is the implant. Open. First thing we do is make an incision. After we make an incision, we do what we call reflecting a flap, which is simply opening up the gum, exposing the bone. Flap is reflected, as you can see, there's the bone. So now we're getting ready to make our first placement. It'll be about right there. You better if you come over here. First pilot drill has been done. This hole is called an osteotomy, and it's one of a series. Okay, we're going to do a few more. The step drill that makes the osteotomy sites for the implant. Increasingly larger diameter step here. Put the implant diameter. That's going into the bone, and this is like a carrier button.
taking care of.
X-ray. In about 3 or 4 months, we're gonna uncover this and put a crown on top of it. All right. Great job, ladies. We do this at Auburn Dental Care every day. Come see us. Dr. Marlon Jackson, Auburn Dental Care, and I just want to show you how missing teeth can be replaced with implants and what are the parts. A lot of people don't understand what parts are involved in putting an implant. An implant is usually is the reverse of taking out a tooth. You put a tooth into the bone under the gum, allow it to heal, and then you put what we call an abutment on top of that, of which you put the crown on. I'm going to show you exactly how to do that today. As you can see here, this is a crown. Under this is an is an abutment. Okay, it's a little tight, which is good. All right, right here is the abutment. Now what we're going to do is take off this abutment on this model and put it into the patient's mouth and screw it in place. I'll be back in a minute. After we place an implant on, you put a healing cap on, and what it does, it keeps the gums in a certain configuration. Okay? Now I'm going to take the healing cap off. It's pretty simple. And okay, the healing cap is out. Real quickly. Okay. That's the implant that's underneath the bone and the gum, of which we're getting ready to put the healing abutment on. Abutment is screwed into the implant, and it's simple. Once the implant is screwed, the abutment is screwed on, then we put the crown on. After the crown is placed, then we will take an X-ray to make sure that turn that way. Okay, get real close there. Okay, notice how the implant is in, and it's pretty solid. Okay. Now, does that bother your patient? Okay, and he can't wait to use it this evening. All right, we'll see you back. We're going to take an X-ray to make sure it's seated satisfactory. We'll see you in a minute. The X-ray shows a satisfactory fit of the crown, so now all I'm doing is tightening up the screws, maximum torque to stay on. Okay. You doing all right, patient? Mm-hmm. All right. Okay. Now what I'm doing here is I'm putting a piece of cotton in here, and the reason why is if I ever have to go back in, if the crown breaks or something like that, I can go in here and unscrew this implant without messing up the thread that holds the abutment to the implant. Let's take that other piece. I need a little, no, I'm done. I need some A little flowable now. And you know what? I need a little condenser. Abutment and seal off this opening. We're going to put a little mobile composite in here and cure it.
Little shower.
It's tight. That's what he wants. Okay, we're putting in the crown. It's a cement, a Navia cement. Put it back down for me. Does it feel the same way it did?
I new charge in there.
That's good. Okay, let's hit the light for a minute. 2 seconds.
21,000. 21,002.
Crown is on. Before the cement's sent, it's important to make sure you can floss between the teeth, which, there we go. It's fine.
Maintain isolation for 5 minutes. Going all the way through.
So we'll see him again in a few minutes. But that's it. The crown is pretty much on. Patient did well. Kira did well. Thank you, Kira. My trusty assistant right there. Okay, give him your trademark. And Kira, and Myra. Myra's on the last one when you what? Okay, I'm not gonna grab the camera from you this time. Thank you, Mr. D. And thank you. Come see us at Auburn Dental Care.